everyone! For today's lesson, we're going to discuss the clean and green environment. First, may I ask if you have been sick with fever lately? Having a cold with your nose, turning red and sore from wiping too often is never a good feeling. Neither is having diarrhea that wakes you up in the middle of the night with the awful feeling like your stomach wants to turn inside out. It is a good thing that you receive a medical intervention at once and your body got well. But do you know that acute respiratory infection and dehydration from diarrhea are important contributing causes of death among children here in the Philippines? The same is true in other developing countries. According to the World Health Organization, the worsening conditions of slum dwellers in big cities contribute to the increased incidence of diseases. Diarrhea is common when there is improper handling and distribution of water supply. Now, what are some of the diseases and disorders caused by poor environmental sanitation? Let's find out. First is the respiratory diseases. So what are respiratory diseases? Anyone? Okay, it is the illness that affect the respiratory system, including the nerves and muscles of breathing are called respiratory diseases. For example, the common cold, sore throat, asthma, and primary complex or tuberculosis. These problems are triggered by poor sanitation and hygiene practices. Children whose body resistance is low are more prone to respiratory illnesses. One of the common respiratory illnesses brought about by poor environmental sanitation is the common cold. When you experience itching or sore throat, runny nose, sneezing, nasal congestion, watery eyes, and mucus drainage, then you have the symptoms of the common cold. The common cold is a viral infection of the upper respiratory tract caused by many different viruses. Number 2 is the skin diseases. What are skin diseases? Any idea? Very good. The skin is the largest organ of the body that contains nerve endings that sense pain, cold, and heat. When the skin comes into contact with pollutants, it results to some illnesses like scabies, ringworms, and other skin infections. Do you understand, class? Okay, let's proceed to the number 3, the neurological impairment. So what are neurological impairment? Anyone? Very good. Neurological impairments are diseases that are related to the brain and spinal cord. One cause of this problem is mercury poisoning. If we say mercury poisoning, it is a type of metal poisoning and medical condition caused by exposure to mercury or its compounds. You may have heard of factories that use the heavy metal mercury in their industrial production. Some of this mercury escape in the environment of these factories. When the heavy metal mercury comes in contact with people, it can seriously affect the vision, hearing, and speech. That is the neurological impairment. And lastly is the gastrointestinal diseases. So what is gastrointestinal diseases? It refers to diseases involving the gastrointestinal tract, namely the esophagus, stomach, small intestine, large intestine, and rectum, and the accessory organs of digestion, the liver, gallbladder, and pancreas. For personal hygiene, poor environmental sanitation, and limited access to clean water lead to some gastrointestinal diseases like number 1, diarrhea. It is the opposite of constipation. It is the condition of unusual frequent and liquid bowel movement. Some of the causes of the infection are viruses, bacteria, and other organisms and contaminated food. Number 2 is the cholera. It is an infection of the small intestine that may result in severe diarrhea. This can lead to dehydration, electrolyte, and even death if untreated. Transmission occurs primarily by drinking water or eating food that has been contaminated. Cholera can be prevented by access to safe drinking water, good hygiene, and good sanitation. Number 3 is the dysentery. It is an infectious disease. It is passed through the ingestion of food and water that has been contaminated. The transmission is often by infected individuals who handle food with unwashed hands. It commonly occurs when people are crowded together and do not have access to proper sanitation facilities. That is the clean and green environment all about. Do you understand, class? Okay, very good. For your activity, interview at least 5 people from your community. Ask them if they have suffered from the following diseases and disorders and write down the disease they have suffered. Do you understand? Okay, that's the end of our lesson. Thank you for listening and watching. Goodbye, class.